others and through exercise. And exercise is a wonderful way to relieve ourselves of stress. In spirituality, to which I just alluded, in spirituality is where you're not focused on yourself. In that sense I'm talking about. So it could be through religious experience. It could be through through an active social process of giving. It could be community service. It could be a myriad of things that involve us in something that doesn't involve us meeting our own selfish fleshly needs, but meeting somehow a need that we have that's altruistic in nature, perhaps, a giving type of process. So spirituality, and knowing that there's something greater than us that we're a part of. And through socialization, which all of the other ones involve, some of the other ones involve, such as sports, and spirituality in the congregation in church, socialization through getting with others in a meditation class or community class, education class, and then in the practice of yoga. Often yoga is practiced in a classroom setting. So these are some of the things that you can do to reduce stress and thereby reduce craving. Community resources are real important in combating the cessation of the process of smoking cessation. So one important community resource is that of Nicotine Anonymous. Nicotine Anonymous includes the socialization that I just mentioned. That's a part of a component of healing, and also the 12-step community is a tremendous support for somebody. It's a group of people. In numbers you can accomplish a lot more. Whereas where you have the story of the how many oxen does it take to pull one log? It takes two. How many does it take to pull 2 logs? It takes 3. And how many does it take to pull 4 logs? And then so on and so forth. It only takes, and then 8 logs, 3 oxen can pull. So there's a geometric progression that's involved through the strength of increasing, through the increasing numbers, and thereby increasing the strength of the force that's being utilized. Don't forget the family physician. Medicine. Medicine is another extremely important complement to the therapies and interventions in smoking cessation. A lot of times people think that they can't do it chemically, but there's no reason that you shouldn't be able to do that under the supervision of a medical professional. An MD or a DO can provide the medical management of the prescribed medications that can help, much as hypnosis can help and much as Nicotine Anonymous can help, or some of these other community resources. Or a psychiatrist, if you will, if you would like to go to a psychiatrist who's more specialized and they deal more with the nervous system and the behavioral dynamics of smoking cessation. They can address some of the social issues and that involve the behavioral dynamics involved in the problematic cessation of smoking, because somebody comes through the door and they're lighting up a cigarette, and then we intended not to smoke, and the fact that somebody else is smoking. A doctor can appreciate these things of peer influences just as a counselor can. And we want to take a look at going to perhaps a counselor to talk about somebody that may be an addiction specialist or a non-addiction specialist, somebody who can appreciate the fact that they're going through a difficult time emotionally, perhaps through smoking cessation. And then a massage therapist. Massage therapists can provide instant anxiety reduction through the relief of the physiological results that occur that decrease through the stimulation of the massage therapy, the anxiety that a person feels, and thereby transfers into the emotional decrease in anxiety. This is a process that I want to introduce to you and to present to you as something to think about when you're achieving the cessation of smoking. We'll talk more in part 2 about how to go through the emotional difficulties and some of the physical difficulties that occur during the smoking cessation process.